The traditional biopsy involved passing a needle through an ultrasound probe placed in the rectum that went through the wall of the lower intestine into the prostate to take needle samples. The needle samples are about 1 inch long and pretty small, but it still had to go through the wall of the intestine, which is not the cleanest place. And around 5 to 6% of people would get an infection that required a hospital stay. And that's how we had been doing this for years, and typically the average patient had 12 needle samples taken from their prostate, which means at least 12 needle sticks through the lining of the intestine, and a couple more needle sticks to place long-acting Novocaine like local anesthetics. So what happened here more recently is a simple, clean idea in that the ultrasound is still used, but there is no biopsy through the intestinal wall. Everything goes through the skin, and there's only 2 needle sticks on the skin. So similar in size to what you might have if the laboratory draws blood from your arm. And that 1 needle stick is large enough that the biopsy needles can be passed through that needle into the prostate, and we can take as many needle samples as we want. So an amazing thing happened with this. Nobody gets an infection. Nobody gets an infection even without any antibiotics. So what a tremendous safety and cost savings step. And along the way, even a better thing happened. The traditional numbers vary a little bit, but somewhere between 20, 30, 40% of people that would have a biopsy, we would find the information that we needed. Now that we've moved up to this other technique where we take more needle samples and we sample the front part of the prostate, which was traditionally very difficult to get adequate samples because the prostate sort of hides behind some of the bones in the pelvis and such. The detection rate now is in the 70%. When we have a much better detection rate with the first biopsy, all those downstream activities and other tests and running around to labs and x-rays, which patients just hate, obviously, appropriately so, can be avoided.